Good morning, students. Welcome back to Pharmacology Made Simple. In today's class, we will be discussing about the second part of pharmacodynamics. So we will see about therapeutic index. The median lethal dose of a drug is the dose which is lethal to 50% of the population. And the median effective dose is the dose that produces a desired effect in 50% of the test population. Therefore, therapeutic index is the ratio of the median lethal dose to the median effective dose. Therefore, the formula for therapeutic index is equal to the median lethal dose by the effective dose. So why therapeutic index is very important for us to know? It is important because it gives an idea about the safety of the drug. The higher the therapeutic index of a drug, the safer is the drug. Therapeutic index varies from species to species. Therefore, the test on all different species is required. For a drug to be considered reasonably safe, its therapeutic index should always be more than 1. And penicillin has a high therapeutic index while lithium and digoxin have a low therapeutic index. Therapeutic index may be different for each action of a drug. For example, therapeutic index of aspirin used for headache is different from its therapeutic index for inflammation. Okay, so here we can see the image about the therapeutic index. So for 50% of the population, what will be the therapeutic effect and the toxic effect we will be seeing under the therapeutic index. Next, we see about therapeutic window. Therapeutic window is the plasma concentration range below which the drug is ineffective and above which toxicity appears. Hence, it is desirable to have the plasma concentration of drugs within the therapeutic range. Some drugs, like those with low therapeutic index, have a narrow therapeutic window. Example, clonidine. The doses of such drugs should be carefully titrated. Okay, so why therapeutic window is also important is because it is the plasma concentration range below which the drug will become ineffective and above which toxicity will happen. So many times when we are taking such drugs like antihypertensive drugs or anti-epileptic drugs, we cannot suddenly stop the drugs. The dose of the drug has to be reduced slowly and then only it can be stopped, because once suddenly if the drug is stopped, again the problem might arise. Next we see about drug synergism. When two or more drugs are given concurrently, the effect may be additive, synergistic, or antagonistic. First, we'll see about the additive effect. The effect of two or more drugs gets added up, and the total effect is equal to the sum of their individual actions. Examples are ephedrine with theophylline in bronchial asthma, nitrous oxide and ether as general anesthetics. Okay, so generally what will happen here, the two drugs are given together, but the total effect is equal to the sum of their individual actions. Whereas in synergism, when the action of one drug is enhanced or facilitated by the other drug, the combination is called synergistic. In Greek, ergon is equal to work and syn is equal to with. Here, the total effect of the combination is greater than the sum of their independent effects. So note the difference between additive effect and synergism. Whereas in additive effect, we said that the Effect is equal to the sum of their individual actions, whereas in synergism, what happens is the effect is greater than the sum of their independent effects. It is often called potentiation or superadditive effect. The examples of synergistic combination are acetylcholine plus physostigmine, levodopa plus carbidopa. So here we can see an image of the synergistic drug. So what it is saying is working together, these pairs are amazing as they amplify each drug's effectiveness by at least 4 times. Next, we move on to drug antagonism. One drug opposing or inhibiting the action of another is called antagonism. What is it? One drug opposing or inhibiting the action of another drug is called antagonism. Based on the mechanism, antagonism can be classified into chemical antagonism, physiological antagonism, antagonism at the receptor level, reversible or competitive antagonism, irreversible antagonism, and non-competitive antagonism. Here in the image, we can see about the illustrations of sites of actions of agonists and antagonists. In the first image, you can see about the action of a full agonist. What is happening? The agonist will come and bind to the receptor site, and thus the action will take place and there is a response which will be happening. Whereas in the next image, we can see the image of the partial agonist. What is happening? Agonist. What is happening is only partially only it is getting attached to the receptors and therefore the effect is submaximal response. Whereas in complete antagonist, what is happening instead of the agonist binding to the receptors, the competitive antagonist will come and bind to the receptor. Therefore, there will be no response and the antagonism of the agonist will happen. Whereas in non-competitive antagonist, what happens is the antagonist will bind to a different site of the receptor, whereas the agonist will bind to a different site, and the effect will be unsurmountable antagonism of an agonist. Next, we see about chemical antagonism. Two substances interact chemically to result in inactivation of the effect. Example, chelating agents inactivate heavy metals like lead and mercury to form inactive complexes. Antacids like aluminum hydroxide neutralize the gastric acid. Physiological antagonism. Two drugs act at different sites to produce opposing effects. For example, histamine acts on H1 receptors to produce bronchospasm and hypotension, while adrenaline reverses these effects by acting on adrenergic receptors. Insulin and glucagon have opposite effects on the blood sugar level. Next, antagonism at the receptor level. The antagonist inhibits the binding of the agonist to the receptor. Such antagonism can be reversible or irreversible. We have seen this clearly in the images. So in reversible or competitive antagonism, what happens? The agonist and antagonist compete for the same receptor site. By increasing the concentration of the agonist, the antagonism can be overcome. Thus, it is called the reversible antagonism. Whereas in irreversible antagonism, the antagonist binds so firmly by covalent bonds to the receptor that it dissociates very slowly or it does not dissociate at all. Thus, what will happen? It will block the action of the agonist, and the blockade cannot be overcome by increasing the dose of the agonist, and hence it is irreversible antagonism. Example, adrenaline and phenobenzamine at alpha adrenergic receptors. Next, we see about non-competitive antagonism. The antagonist blocks at the level of receptor effector linkage, that is, at different site beyond the receptor and not on the receptor. For example, Verampil blocks the cardiac calcium channels and inhibits the entry of calcium during depolarization. It thereby antagonizes the effect of cardiac stimulants like isoprelin and adrenaline. Next, we see about the factors that modify the effects of drugs. Various factors modify the response to a drug. They are body weight. The recommended dose is calculated for medium built persons. For the obese and underweight persons, the dose has to be calculated individually. The formula for calculating the dose of the drug is equal to body weight in kg divided by 70 into average adult dose. Remember these formulas. The dose of the drug calculated by body weight is equal to body weight in kg divided by 70 into average adult dose. Next, coming to age, the pharmacokinetics of many drugs change with age, resulting in altered response in extremes of age. In newborn, the liver and kidneys are not fully mature to handle the drugs. Example, chloramphenicol can produce gray baby syndrome. The blood brain barrier is not well formed and drugs can easily reach the brain. The gastric acidity is low, intestinal motility is slow, skin is delicate and permeable to drugs applied topically. Hence, calculation of the appropriate dose based on the body weight is important to avoid the toxicity. So, therefore, in children, it is very, very important to calculate the dose of the drug according to the age of the child and the weight of the child. The formula for calculation of dose for the children is the Young's formula. Remember this formula. Child dose is equal to average years, average age in years divided by age plus 12 into adult dose. The formula is child dose is equal to age, the present age of the child in years, divided by age plus 12 into adult dose. In the elderly, the capacity of the liver and kidney to handle the drug is reduced and they are more susceptible to adverse effects. Hence, lower doses are recommended. Example, elderly are at a higher risk of ototoxicity and nephrotoxicity by streptomycin. Next, sex. The hormonal effects and smaller body size may influence the drug response in women. Special care is necessary while prescribing a drug for pregnant and lactating women and during menstruation. Coming to species and race, response to drugs may vary with species and race. For example, rabbits are resistant to atropine. Such variation makes it difficult to extrapolate the results of animal experiments. People who are black need much higher doses of atropine to produce mydriasis. So, so depending on the species and race also, the drug can get affected. Next, depending on diet and environment. Food interferes with the absorption of many drugs. For example, tetracyclines form complexes with calcium present in food and are poorly absorbed. Then, polycyclic hydrocarbons present in the cigarette smoke may include microsomal enzymes resulting in enhanced metabolism of some drugs. Next, we see about the route of administration. Occasionally, route of administration may modify the pharmacodynamic response. Example, magnesium sulfate given orally is a purgative, but when given IV, it causes the CNS depression and has anticonvulsant effects. And if applied topically, it reduces the local edema. Hypertonic magnesium sulfate retention enema reduces the intracranial tension. So here we can see one specific drug, that is magnesium sulfate, but when given in different routes of administration, it has the different effects. Next, coming to genetic factors, variations in an individual's response to drugs could be genetically mediated. Pharmacogenetics is concerned with the genetically mediated variations in drug responses. The differences in response is most commonly due to variations in the amount of drug metabolizing enzymes, since the production of these enzymes is genetically controlled. Next, we see about drug tolerance. What is drug tolerance? Tolerance is the requirement of higher doses of a drug to produce a given response. Tolerance may be natural or acquired. What is natural tolerance? The species or race who show less sensitivity to the drug. Example, rabbits show tolerance to atropine. Black people or black race are tolerant to mydriatics. Whereas in acquired tolerance, the person develops tolerance on repeated administration of a drug. The patient who was initially responsible becomes tolerant. Example, barbiturates, opioids, and nitrates produce tolerance. What is cross tolerance? It is the development of tolerance to pharmacologically related drugs. Example, to drugs belonging to a particular group. Thus, chronic alcoholics also show tolerance to barbiturates and general anesthetics. Next, we see about tachyphylaxis. Tachyphylaxis is the rapid development of tolerance. When some drugs are administered repeatedly at short intervals, tolerance develops rapidly and is known as tachyphylaxis or acute tolerance. Example, ephedrine, amphetamine, tyramine, and 5-hydroxytryptamine. So, what is tachyphylaxis? It is the rapid development of the tolerance when some drugs are administered repeatedly at short intervals. So, hope this is clear, students. So, with this, we come to the end of the unit of pharmacodynamics. In the second part, the important questions which could be asked for you will be about therapeutic index and therapeutic window. Then, what are the factors affecting the drug action, and also the simple questions like what is drug tolerance, what is tachyphylaxis, and about the various different forms of antagonism also could be asked as a 2-mark question. Thank you.